welcome to Mondo Calaveras, a program about all things awesome in Calaveras. And I have a great program today. It's with Wendy Alt, who is the Director of Mental Health in Calaveras County. Officially, what's your title?
Behavioral Health Deputy Director of Clinical Services.
Well, welcome to Mondo Calaveras.
Thank you.
How are you?
Good, and yourself?
I guess I'm pretty happy. Yeah, which leads me to my first question about mental health in Calaveras County. You told me that depression is the most common malady that you see, and I have some experience with depression, so I know it can be quite debilitating. Mine was a situational depression that lasted about 5 years, and it was difficult. But eventually, with the help of counselors, I got through that, and so I have great respect for people that do what you do. So tell me about what the county can do for people that suffer from depression, because it's so common and so debilitating.
So first, I do want to thank you for sharing with me and the rest of us your experience. And the best thing I can say is reach out for help. Reach out. It's there. It's not uncommon. It happens a lot. Yes. County Behavioral Health, we serve what's called the mild to moderate population, Medi-Cal clients, and our number one diagnosis is depression, but we do have private providers and other areas you can reach out. You could call our department and get referrals if you don't have Medi-Cal, but you can be seen at the county level with Medi-Cal.
Gotcha. My experience with depression, it's funny how I like to talk about it, because it's something that I was able to overcome. So I think of it as an achievement. So when people talk about depression, I like to chime in and say, all right, this is what depression was for me, and it may be the same for other people that are out there. For me, it was like I had a craving, the way maybe an addict has a craving for heroin, or an alcoholic for alcohol. I had this craving during my depression episodes. My craving was to do nothing. All I wanted to do was lay on that couch and watch ESPN, or maybe not even that. I just wanted nothing. And is that typical?
Yes, that is very typical. You lose interest in all things that you once found enjoyable, whether that's people that you're used to being around, family members, dogs, activities. You just kind of lose all that interest, and it's a struggle to get that back. It's work, and it takes every day going forward and trying to get past that.
I gotcha. All right, so if we struck a chord with somebody and they thought, well, I could use some counseling, how do they get in contact with you?
They would call our behavioral health during the day at 209-754-6525, and if they're having any type of issues and wanting help and to call anonymous or anything like that, we do have a 24-hour number. It's a 1-800 number, and so it's 1-800-499-3030, and you would be referred to us. And we are getting ready to launch with the rest of the nation 988. You could call it right now, and you are referred to the suicide hotline, and then they will get you back to your county, but it's not instant like the plan is for it to be later. But again, it still works.
Okay, I can see it's important. I know a tiny bit about this. It's like a 911 thing,
yes,
where it's just 3 digits that you call,
yes,
but it's for a suicide
mental
hotline?
health, yes.
Mental health hotline?
Yes.
Is it not specific to suicide? It's all mental health, or what?
They will help refer for all mental health, yes.
I gotcha. And it is 988?
Yes.
All right, I got it right. All right, so pretty soon we'll all know
But
this.
if you call 911 in our county, you will still get referred and get help as well.
Okay. Do you often have to deal with people in crisis over the telephone, and it's an emergency?
Yes.
Really?
Yes.
I'm sorry to hear that, but good job. Okay, tell me about that.
So I do have a few statistics on that for you. In 2020, we had 1,531 crisis contacts. That isn't broken down to telephone or in the field. We go to the field also. So that's just our number for 2020. And in 2021, we had 2,269 crisis contacts. In 2020, of that, 156 people were actually placed on a 5150 hold. So they were held, and in 21, it was 268. So our numbers are increasing, and
So the obvious question is that related to the COVID-19 pandemic?
I would say yes, that it has really affected a lot of people. A lot of things that individuals do to cope, even if they're on the verge or life's just changing, it's difficult, and that sometimes is a trigger. So their supports have all changed, and it's hard to get past.
How big a factor is substance abuse in the mental health of the people in our county?
It's pretty big. I didn't bring any of our statistics for that, and we're currently in a process of changing from a substance abuse program where you have to pay as you come, which is really difficult, especially if you're struggling with an addiction, to find the money to pay for help. We were granted drug Medi-Cal, so we're going to be able to bill the state for it and not have to charge, and then have a sliding scale for anyone that does have an income. But we do have full program.
Okay. What typically are the types of drugs that people have difficulty with abuse and addiction with?
A lot of it's methamphetamine.
Really? All right. And someone my age, I'm 60 something, we're not really used to methamphetamine. I watched Breaking Bad though.
Pretty close. There you go.
How does that typically manifest? Somebody that's having difficulty with meth?
If it's somebody that hasn't really grown up around it or anything like that, sometimes it will lead to, there was an injury, you may have been on some type of medication, or experiencing something where you have medication at the time and then no longer able to get that medication, and it's substituted then for a cheaper, easier to get drug because there's an addiction made.
What's the cheaper, easier to obtain drug?
Would be the methamphetamine.
No kidding. Okay, all right, I get it. How about alcohol? That's more what I'm used to from my generation.
So that is still an issue, and we have a DUI program here in Calaveras County, which is full because surrounding counties have had to close theirs due to COVID, so they weren't able to keep going. We're full, and it's going, and it's still a problem too.
Yeah. I think when I think of homelessness, I think as someone that's not close to the situation, I think of those people as people with alcohol addictions. And so my question would be, do we have a homeless population problem that have mental health issues in Calaveras County?
I would say yes, that we do have. Yes, both. It's when we say in Calaveras County, it's very different than when you get on the freeway and you drive through other areas where there's clearly homeless. But we do have a population, and for us, it's just a little bit different. It's colder. It's harder for people to survive here, being homeless and having whatever addiction it is. But we do have seen an increase in that.
Right. The images I've seen are of Sacramento, where you see the encampments with tents, or in the Bay Area where you see the RVs that are just lined up on the side of the streets, and these people are just parking where it's just a parking spot, and they move it as often as they have to, like when the police send them, or in LA, which has all of the above. Okay. I saw a statistic, it was some time ago, but it said that there were about 800 homeless people in Calaveras County. Do you have it?
I don't have that. We just finished our point-in-time count on trying to collect all the data on the homeless individuals that we have. That does include different technical terms of homelessness. So it's not just somebody that you would see in the tent on the street. So,
right.
But I don't have that with me right now.
So if you live in your car, are you considered technically homeless?
Yes.
Okay.
Yes.
But if you live in an RV,
Then
that's, it's got a bathroom and everything.
Right.
Is that homeless?
no, and neither is couch surfing.
That doesn't make it into the statistics. So homelessness could be a bigger problem than we even know.
It could be, yes.
Yeah, although in Calaveras County, we're a small county. We have a few.
We do. We do have a few individuals, and our sheriff's department is really good reaching out to behavioral health. We have 2 triage workers who are stationed in the jail. They work with the sheriff's deputies, so if deputies run into people, they'll reach out to behavioral health and say, hey, what can you help us? And a lot of times, like you mentioned, the homeless individuals may be suffering from whether it's addiction or mental health problems, so these individuals try to triage, jump in and say, what could we do? Do you have any relatives? How'd you end up in Calaveras County? What are these barriers? What can we help you with to get them help to hopefully find some type of housing?
So are you saying that, and you probably will, okay, you will probably say that our sheriff's deputies, our city police forces do a nice job in dealing with what is obviously a very difficult problem for them.
They do the best that they can. They don't have a lot of freedom in what they're able to do, but they do reach out and try to get services provided for the individuals.
Yeah. All right, so that begs the question. Do you think there's value in changing the funding of our state and county services to send more money to people that are trained with counseling, trained counselors instead of the sheriff's deputies? Okay.
So this,
you know where I'm going here.
Yes.
There's a name for this, and I don't want to say it because I don't think it's poorly named.
Yes.
Okay?
So we in Calaveras County, we actually have just been awarded a grant. It's to have a mobile crisis unit, and what we have right now are triage workers who can work in the field. We don't technically have a mobile crisis unit, so we're working together with our community partners in seeing what would work the best, and if that means whether it's a clinician or a case manager who goes with law enforcement. But for our small county, we don't feel that it's safe to just send a clinician or a mental health worker without law enforcement right now. So they work really well together, they understand roles, and it's a good checks and balance.
So are you saying that yes, there's some value in considering this, and in fact, we're already doing it?
Yes.
Hey, so, okay. That's terrific. Tell me about a success story that you could think of with mental health in Calaveras County.
All right, we can go back to when I first, not too long after I started, I've been here 7 years, and I had a client who came in to see me in crisis and then was psychiatrically hospitalized. I then saw her upon discharge and with her husband, and she was a completely different person. She never expected to be in that situation. She had a normal life, a husband, 2 kids, a teacher, artistic, just had things put together, so they say. And she had a really severe episode and was able to live through it and then come in for treatment. And, I just saw her a couple of days ago, and completely different person, was able to give her a hug and, hi, how are things? And so it's amazing, and it helps when you reach out for that help. She's connected with her children. She's, lives with her husband and is enjoying her retirement now.
That's excellent.
Yes.
Well, I hope you have a lot of success stories like that.
We do have.
Yeah, but sadly, and you don't have to get into it, there are some that don't end so well. And does that take a toll on the staff?
It does.
Yeah.
It does. It's hard.
It is. Mm-hmm. Yeah. Tell me, what is your, I haven't asked you this yet, for the people that are watching, what's your background in mental health?
I have a master's degree and bachelor's degree in psychology, and I'm a marriage and family therapist, licensed. I've worked for Calaveras County in behavioral health for 7 years. Prior to that, I was in the law enforcement arena, probation.
Then you have some expertise in that question I asked about. And for people that don't know what I was talking about, it was defund the police, which I think is poorly named, and that's what I didn't want to talk about. But I appreciate your expertise. So tell me, what is the state of mental health treatment in the United States? Say, for example, if you were going to describe mental health treatment in the United States to someone that's from Peru that has no idea, can you give me a primer on what you might say to that person?
I would say it's a struggling area in itself. It's just really hard right now to get services. If you are an individual who has insurance, right now it's backed up, 6 months or so for you to receive help. But there's crisis, there's help, and to speak up and ask for that help. That there's still ways to get it. Don't stop. Continue, but you can get assigned a therapist. You can have a psychiatrist evaluate you for medication services. If you're eligible, you would end up with case management services and have whole wraparound what do we need to do?
But I think what you were alluding to when you started was that the United States is not particularly good at this. Worse than we once were? Do you know?
I don't
What do you
know
think?
that. I just think that the more that we learn, the more we realize how much prevention needs to happen instead of being on the back end to kind of clean up.
Yeah. How does California then compare to the rest of the country?
I don't know right now.
Yeah.
Yeah.
We think of California as progressive and that we devote a lot of time and attention and money to various causes, and we know how important mental health is. So I would, and I don't know either, I would guess that we do better than other states.
Right now it's interesting because yes, there's a lot of money thrown our way, and it's kind of the joke in the county that if you need funding, you go to behavioral health because it's just there in wheelbarrows. But they also tie your hands in many ways on how you can spend that, and they also, the requirements, and then just to find the individuals there to staff the positions, even if you do receive the funding, is lacking.
You told me you're looking for someone. In fact, you tried to recruit me.
Yes, I did. Always trying.
Yeah, for people that don't know, I'm a registered nurse, and so I would qualify. I think with training, of course, I would need training. But if someone has a background or might be qualified, how would they contact you about a job?
I would say to check our Calaveras County Human Resource page. We do have some open positions for therapists, for different things right now. So yeah, check it out.
All right. How about children? Do you counsel children?
We do.
Yeah.
And one of the areas that we are kind of ahead in the times, we have just finished kind of getting a wellness center in our elementary schools. So we are helping fund the elementary schools in Calaveras County to have centers where individuals can go, students can go if they're referred by parents, if they're referred by teachers or anyone else, they can be sent to this wellness center, which is a nice comforting place for the students, and they are talked to if they need to talk about coping skills or if something's going on, and then it, depending on what is going on, will depend their level of treatment. So,
And where is that exactly?
well, I don't have all of the schools listed, but most of them all have one in it, and we're going to try to increase that to the junior high and the high schools. So.
Excellent. When many of us think of children and mental health difficulties, we think of attention deficit disorder, hyperactivity disorder, and I would imagine that's still common.
I would say so, but it's not as common. A lot of it is just a lot of trauma and trying to learn how to function in the class and just the world changing and different things like
All right,
that.
so back up a little bit. Explain what you mean by trauma, because to me, that means abuse, physical abuse.
It could be witnessing it. It could be not being cared for. It depends on the circumstance. But remember, we serve the severe Medi-Cal, not the mild to moderate. We are at the severe end. So,
Yeah. Makes it tough. Well, do we have a psychiatrist at our disposal?
We have a psychiatrist who does see our children, and then we have a psychiatrist who sees the adults. They are via Zoom. We have not been able to get a psychiatrist in the office, which is asked for quite a bit by our clients.
And where I work, and I work in oncology, we talk quite often about the difficulties with specialists in Calaveras County because there are not necessarily the numbers that a specialist would need to warrant being here in person. So without the Zoom thing, we'd be really stuck, wouldn't we? So that's pretty good.
Yes.
And I've talked to people that have had sessions with a psychiatrist via Zoom, and they tell me it's great, works great, and they love it. So
yes, a lot of our clients enjoy it. They're okay with it, and then some just they want the person there.
How many counselors do you have?
7.
And how many staff all together?
Under behavioral health, we have 53.
Well, that's more than 7. So what do the other people
Yes.
do?
we have drivers, we have case managers who, a case manager, the term's out there, but they almost do anything that you would think of. They're all a parent in a way. If you need help getting to the DMV or to learn how to fill out a form, whatever barrier it is you have for your mental health in order to have a successful life, the case manager is there to help you have that connection. Then we have an admin side who has to do the billing, the Medi-Cal, and all of that. And then we have the substance abuse side, the counselors and the admin. And we have a peer wellness center that you do not have to be a client. And right now they're closed due to COVID because we can't have any groups, but we'll be opening hopefully here soon. That's in San Andreas by the Pizza Factory. And it offers a place that you can go to just to learn a little bit about mental health.
Good. Knock on wood that this COVID thing is on the downslide and we'll be able to open that up again. Yeah. Great. Cannabis. Can I ask you about cannabis? Because,
You were going on me here.
I did what? Can I? Did I know?
Probably not.
All right.
Whatever the psychiatrist orders.
No. I was gonna ask if
I don't have a card
cannabis-
for you either.
No, I'm not asking for pot. You're killing me. There are no recorded cases of fatalities from cannabis. However, there can be an addiction. Do you see that? Mm-hmm. Yeah.
There could be.
And there can be side effects from overdose. Do we see that?
I can't say that I've seen.
Okay, so I'm running down a road where it's really not a biggie. Is that what you're saying? And that's okay. You can tell me that. All right. Another interesting question I wanted to ask you, because this comes up where I work.
Okay.
How frustrating is it when people self-diagnose? Because everybody can get on Google now,
Right.
and they can do a quick search about something, and then they're sure that they have whatever it might be, Alzheimer's.
Right.
Or do you see that?
We do see that, but if you looked at the DSM, and you look through the diagnosis, you could probably find a lot of the symptoms or different things are common traits, but they don't necessarily mean that there's a diagnosis there.
Gotcha. Okay. Do you see oncology patients? Do they? Maybe we ought to take advantage of that, because my oncology patients, have difficulties and they can use counseling. And we have social workers at the hospital that we could take advantage of. But if somebody is in a crisis situation, which happens, they can call you.
They can call, yes.
All right. So again, how do they contact you?
They
'Cause
call.
people want to know.
Yes, they can call our office Monday through Friday, 8 to 5 at 209-754-6525, or after hours, 1-800-499-3030. And even if you call the other number after hours, it'll roll over to something. So
I
it'll be
gotcha.
okay.
Can people walk in?
Yes, you could walk in for crisis Monday through Friday, 8 to 5. If it is after hours or the weekend, just to the ER.
Okay.
And then what happens is there's a crisis worker on call who is called and said, we have somebody here for you to evaluate or talk to, and then they will safety plan or do what needs to happen next.
How long is the wait if somebody were to walk in?
To behavioral health,
Yes.
it depends if there was one person or so before you, but it's pretty
So
quick.
it's short.
Yes, it's
That's
very.
great. And you're at the government center?
We are behind the government center in Little Portables, 891 Mountain Ranch Road, same address, but just past the red barn and the little trailers.
Okay, so if you just went tooling around in the government center, eventually
Yes, you
they're
would
gonna
find us.
You're in the back.
Yes, yes.
Okay. How long have you lived in Calaveras County?
7 years.
Oh,
a little over 7 years.
Where did you come from?
Yuba County.
All right, forgive me, I'm Floridian. I've only lived here for 8 years. Where's Yuba County?
It is next to Sacramento.
Oh, so you didn't come from too far.
No.
And so you're native Californian?
Yes.
Right, all right. And what is it that you particularly like about living in Calaveras?
The calmness, Yes. Yes, the mountains, the being able to open my front door and go to the trail when I need to.
What's your favorite trail? I ask this because I want to know because I need more trails.
So that's hard, but my go-to trail, because it's close, is just going around Hogan and then up to the coast of the Crest.
Yes, and that's
Yes.
beautiful.
Yes.
Yes. I can recommend highly going up near Lake Alpine, especially in the snow when they block off the road. And you want some nice meditative time to help you with your mental health crisis. Well, maybe not crisis, but just walking on the hard-packed snow past Lake Alpine is a beautiful thing.
And that is a good thing to do for your mental health, for sure.
Yeah. What other things might you recommend?
I would say when you can, get some vitamin D, and doing the walks, taking a shower.
Yeah.
If there's a meditation or music or something that you like, turn it on, even if you can't fully concentrate. It's going to help.
Good. Good. All right, I have a silly question for you because this is Mondo, California, Calaveras, California too. Okay, here's my silly question. If you could get rid of one state, which one would it be and why? I'm freaking her out, people.
I know. I really don't know.
You have to get rid of one state. I'm going to say Rhode Island is too small. Let's conglomerate that into some other state.
Okay.
All right, that's it.
I know. Sorry.
Did you have a good time?
I did. Thank you.
Is there anything else that people have to know before we say goodbye?
Just reach out. Be the one. And if you are concerned about anyone that you care about, you can reach out for them. And we can't always provide you the information or anything like that, but we can take what you give us and do the reach out for you.
Okay. I joke too much sometimes. It's a criticism I've heard before. Okay. But it's a serious and important thing that you do. And if people need help, there is help out there.
Yes.
Okay. And I want to thank you very much. This is Wendy Alt. You are the Director of Mental Health for Calaveras Behavioral Health Services.
Yes.
Right? So thank you for coming on to Mondo Calaveras.
Thank you so much for having me.